All right, let's jump into our deep dive today. We're going to be taking a look at the CVS Health 2023 annual report. You sent this over to us. Looks like you're really interested in getting a handle on. You know what CVS has been up to lately, where their strategy seems to be headed, and how they're positioned in this crazy world of healthcare that's always changing.
Yeah, absolutely. I think there's a lot to unpack here. One of the things that really jumps out at you right away is that CVS is really aiming to be a lot more than just a pharmacy chain. You know, their CEO, Karen Lynch, she's talking about building a world of health around every consumer. Pretty ambitious goal.
It really is ambitious.
Yeah.
But they're not just talking, are they? They've actually launched this new brand, CVS Health Spire, to kind of bring together all their different services: healthcare delivery, pharmacy benefit management, and a whole bunch of other health services, all under one roof. You know, aiming for that seamless experience that every company seems to be after these days.
It's true. It's a strategy we're seeing more and more in healthcare, creating this kind of ecosystem of services to try to keep customers engaged and within their network. And it seems to be working for them. You know, over 55 million consumers are using at least two of their different offerings.
That's a big number. It makes you wonder, what is the magic behind this integrated approach?
Well, the report gives us a clue. It says that Aetna members, who are using multiple CVS Health businesses, actually have a 3 to 4 times higher lifetime value for the company.
Wow. That's pretty significant. So weaving all those services together isn't just convenient for the consumer, it's also incredibly profitable for CVS. But why is that? Are those people just spending more overall, or is there something else going on?
That's a really good question. You know, it could be that these types of customers are simply healthier. Maybe they require less expensive care. Or maybe they're just more engaged in managing their own health, which leads to better outcomes and lower costs in the long run. It's possible that by offering a broader range of services, CVS is meeting more of their customers' needs, which keeps them healthier and more loyal to the CVS ecosystem. Definitely a strategy worth watching.
Yeah, for sure. Definitely seems to be a key part of their game plan. Now let's zoom in on a specific piece of that ecosystem. Let's talk about their pharmacy benefits management operation, sometimes called a PBM, called CVS Caremark. They serve a massive 108 million members.
And to give you a sense of the scale, they processed something like 2.3 billion pharmacy claims last year. It's really a testament to their focus on affordability and making sure that people can get the medications that they need.
Yeah, that's a lot of prescriptions. Speaking of medications, the report highlights their new subsidiary, Cordavis, which is all about these biosimilar products. I've heard that term before. But can you break down what biosimilars are exactly and why CVS is diving headfirst into this market?
Sure. So think of biosimilars like the more affordable versions of, you know, those complex and often super expensive biologic drugs that you hear about. They're basically designed to work the same way as the original, but they're produced through a different process, which makes them much cheaper.
So it's kind of like the generic version of a brand name biologic drug.
Exactly. And to illustrate how much of a difference this can make for customers, the report highlights their upcoming release of a Humira biosimilar called Hurimoz. It's going to have a list price over 80% lower than the original Humira.
Wow. Have the game changer for people who rely on these expensive medications. Seems like CVS is trying to position themselves as a champion of affordability. But let's shift gears for a sec and look at the nuts and bolts of their business. Can you break down the different segments that make up CVS Health?
Yeah. So the report outlines 3 main segments: healthcare benefits, health services, and pharmacy and consumer wellness.
Okay, let's break those down one by one. What falls under healthcare benefits?
So that segment's all about providing health insurance, including different Medicare plans. So they're essentially taking on the role of a traditional health insurer.
Interesting. What about health services? What makes that segment unique?
That segment is where we find their PBM operation, CVS Caremark. But it also includes their growing network of medical clinics and even their move into home healthcare services. So they're covering a lot of ground.
It sounds like they're trying to be a one-stop shop for a lot of healthcare needs. And finally, there's pharmacy and consumer wellness. Is that their retail pharmacy business? All those CVS stores that we see everywhere?
Exactly. That's the most visible part of their operation, with over 9,000 CVS pharmacy locations across the country.
So they've got their hands in a lot of different pots. Now, the real question is, how did all these segments perform financially? Did their world of health vision translate into cold, hard cash?
Well, before we get into the numbers, It's worth noting that the report states that CVS Health has filed all of the required financial reports and attestations. So we can be confident the information we're looking at is reliable.
Okay, good. Transparency is always appreciated. All right, what are the key figures? Paint me a picture of their financial health.
Overall, it looks pretty healthy. Total revenues for 2023 increased by 10.2%, reaching $357.776 billion. Their adjusted operating income also saw a significant increase, reaching $17.534 billion.
Wow, those are some impressive numbers. Seems like their strategy is paying off. But did they just sit on their cash pile? Or were they actively making moves to secure future growth?
So they were definitely not sitting still. The report really emphasizes the importance of acquisitions in their growth strategy, particularly two major acquisitions they made in 2023.
You're talking about Signify Health and Oak Street Health, right? I remember reading about those deals. Weren't those both involved in expanding CVS's footprint in primary care and home health care?
Yeah, you got it. Signify Health brought their expertise in in-home health risk assessments, basically going into a patient's home and getting a better picture of their health needs. While Oak Street Health added a network of primary care centers focused on Medicare patients. Those acquisitions are really interesting because they signal a shift away from traditional pharmacy services.
It does feel like they're positioning themselves to be a major player in the evolving healthcare landscape. But we've only just scratched the surface of this report. I'm ready to dive even deeper into these acquisitions and see how they fit into the bigger picture.
Let's do it. There's a lot more to explore in part 2 of our deep dive.
Okay, we're back, ready to continue exploring the CVS Health 2023 annual report. Last time we were talking about those big acquisitions, Signify Health and Oak Street Health. I'm really curious to dig into those a little bit more, see how they're reshaping CVS Health's role in healthcare delivery.
Yeah, it's clear from the report that those acquisitions are a big part of their strategy. And what's interesting is that both Signify Health and Oak Street Health really operate in the realm of what's called value-based care.
Oh yeah, I've heard that term before. Can you remind me what that means and why it seems to be gaining so much traction in healthcare these days?
Yeah, so it's a model that's really about shifting the focus from simply providing more services to actually achieving better health outcomes instead of that traditional fee-for-service model where providers get paid for every test, procedure, or visit. Value-based care incentivizes them to keep patients healthy and prevent unnecessary care.
So more like fee for value. Providers are rewarded for keeping their patients well, rather than just treating them when they get sick.
Exactly. It's a big change from the way things have traditionally been done, and a lot of experts believe it's essential for improving the quality and affordability of healthcare.
Yeah, that makes sense. So how do Signify Health and Oak Street Health fit into this value-based care model? What are they actually doing out there in the real world?
Well, Signify Health is known for conducting those in-home health evaluations that we talked about earlier. So instead of waiting for patients to come to a doctor's office, they're going directly to their homes to try to get a more complete picture of their needs.
Yeah, that seems like a really proactive approach. Meeting patients where they are, literally, gathering all this valuable data to help manage their care.
Right. And it can be particularly helpful for patients who might have difficulty accessing traditional care settings, like people in rural areas or with mobility issues. The information they get during these evaluations can be used to create more personalized care plans and even identify potential health risks before they become serious problems.
I can see how that approach could be a real game changer, both for individual patients and the healthcare system as a whole. But wasn't there something in the report about these evaluations also being linked to Medicare payments?
You're right. The report emphasizes that the data collected during these home visits actually contributes to Medicare risk adjustment factor scores. These scores are used to determine how much Medicare pays health plans for taking care of their members.
So the more accurate and comprehensive the information gathered through these home evaluations, the better the health plan understands the patient's needs and the more appropriate the reimbursement for Medicare. It's like a virtuous cycle.
Exactly. And that brings us to Oak Street Health. So they operate a network of primary care centers that cater specifically to Medicare-eligible patients. But these aren't your typical doctor's offices.
Yeah, I was reading about that. It seems like they're going beyond just basic medical care. What are they doing differently?
They're really trying to create a more holistic and engaging experience for their patients. Their centers offer a wider range of services, including social support and even activities to combat social isolation, which can be a big problem for seniors.
So they're addressing not just the physical health, but also the social and emotional well-being of their patients. That's a really interesting approach.
Hmm.
Are they also operating under this value-based care model?
They are. Oak Street Health partners with health plans. And they actually take on financial risk for the total cost of care for their patients.
So they're incentivized to keep those patients healthy and out of the hospital
Oh.
because they're on the hook financially if their health deteriorates.
Right. It's a model that really aligns everybody's interests, the patient, the health plan, and the provider, all around the goal of achieving the best possible health outcomes, while also keeping costs under control.
Sounds promising. But I'm sure there are challenges and risks associated with these acquisitions, too. No investment is a sure thing, especially in healthcare. What does the report say about potential downsides?
You're absolutely right. The report does acknowledge some potential risks. One challenge is simply integrating these newly acquired businesses into CVS Health's existing operations. They have different cultures, different systems, different ways of working. Bringing them together smoothly and creating a unified vision is a big task.
Yeah, it's more than just merging spreadsheets and org charts. It's about blending different philosophies of healthcare and finding a way to make the whole greater than the sum of its parts. Are there any financial risks associated with these acquisitions?
Yeah, the report highlights a couple of key financial risks. For
Right.
example, Oak Street Health is heavily dependent on Medicare reimbursement rates and contracts with a limited number of payers, so any changes to Medicare policies or the loss of a major contract could really impact their financial performance.
Makes sense. And I imagine there's always that inherent risk that these acquisitions just won't live up to expectations. They might not achieve the desired cost savings or quality improvements or growth targets.
You're right, that's always a possibility. It's a gamble, but it seems like CVS Health is making a calculated bet on the future of value-based care and their ability to build a successful integrated healthcare model. They're not afraid to take risks and disrupt the status quo.
It's definitely a bold move. It'll be interesting to see how it plays out. Speaking of potential risks and challenges, the report also spends a lot of time discussing the legal and regulatory hurdles CVS Health faces. I know we touched on government regulation earlier, but I'm guessing there's a lot more to unpack, given how heavily regulated the healthcare industry is.
Oh, it's a minefield out there. So many rules and regulations they have to comply with, from federal laws like pay to state-specific regulations governing pharmacy benefit management practices. It's a lot to keep track of.
I bet. Can we maybe zoom in on a couple of the most impactful regulations and see how CVS is navigating them?
Sure. Let's start with a couple that often trip up healthcare companies. The Stark Law and the Anti-Kickback Statute.
Okay, those names ring a bell. But I'm a bit fuzzy on the details. Can you give me a refresher?
Absolutely. So the Stark Law is all about preventing conflicts of interest. It basically prohibits physicians from referring patients for certain designated health services to entities with which they have a financial relationship, unless an exception applies.
So if a doctor has a financial stake in a medical imaging center, they can't just refer all their patients there for scans without potentially running afoul of the Stark Law. It's about making sure those referrals are based on medical need, not financial gain.
Exactly. And then you have the Anti-Kickback Statute, which casts an even wider net. It prohibits the exchange of anything of value to induce or reward referrals for services paid for by federal healthcare programs.
No more lavish dinners for doctors. In exchange for prescribing certain medications, it's all about ensuring a level playing field
Yeah,
and preventing undue influence.
that's right. And the penalties for violating these laws can be severe, including hefty fines and even criminal charges. So companies like CVS Health have to be incredibly careful about their relationships with providers, pharmaceutical companies, and other healthcare entities.
I can see how that would be a major focus for their compliance team,
Yeah.
especially given how they're involved in so many aspects of healthcare.
Yeah, you're right. They have to constantly analyze their arrangements to make sure they're not crossing any legal lines. And it's not just these two laws. There are countless others they have to navigate, from HIPAA, which protects patient privacy, to regulations specific to their pharmacy benefit management operations.
Yeah, I imagine their PBM business in particular attracts a lot of scrutiny, given all the controversies surrounding drug pricing and transparency in that area. What does the report say about the regulatory landscape for PBMs?
Well, it's a constantly evolving landscape. The report mentions various state and federal laws that are specifically aimed at regulating PBM practices. These laws cover things like how PBMs negotiate drug prices, which drugs they include on their formularies, and even their ability to conduct audits of network pharmacies.
So they're facing limitations on their ability to investigate pharmacies they suspect of overbilling. Sounds like a complicated balancing act. Trying to manage costs while also complying with all these regulations.
It definitely is. But operating in a highly regulated environment is simply the reality for any company involved in healthcare, especially one as large and complex as CVS Health.
We've covered a lot of ground in this segment, from the nitty-gritty of value-based care to the complexities of the legal and regulatory landscape. But through it all, it's clear that CVS Health is making some bold moves to position themselves for the future.
Yeah, they're definitely not standing still. They're evolving, adapting, and taking risks to try to shape the future of healthcare.
Well, this deep dive has definitely sparked even more questions for me. What about you? Are you ready to explore the human side of this story? See how CVS is approaching things like employee development and those ESG goals they mentioned.
Let's do it. Time to shift our focus to the people behind the numbers and see how CVS is addressing some of the broader societal concerns surrounding healthcare. Join us for the final part of our deep dive.
Okay, we're back for the final part of our deep dive into the CVS Health 2023 annual report. We've explored their vision, their financial performance, and even those complex regulations they have to deal with. But now I'm interested in the people who make it all happen.
That's a good point. Behind all the numbers and strategies, it's the employees who are on the front lines, interacting with customers, delivering those health moments that CVS talks about.
Exactly. And the report highlights their commitment to what they call colleague development. Remember that figure? 14 million hours invested in employee learning and development courses. That's huge.
It really is. And it's not just onboarding for new hires. They're offering a range of training opportunities, from leadership development to specialized compliance training, to make sure everyone understands those regulations we talked about.
So they're not just throwing people into the deep end. They're giving them the tools to succeed. What kind of impact is this having on their workforce?
Well, the report suggests they're trying to foster a culture of continuous learning. They're even using tech tools to keep employees up to date.
Sounds like they're building a workforce that's adaptable, knowledgeable, ready for anything.
And it's not just professional development. The report also talks about their commitment to employee health and safety, which is so important for healthcare workers, especially those in retail pharmacies and clinics.
That's true. They're dealing with potential exposure to diseases and even the risk of violence in the workplace. It's a demanding job.
Absolutely. And CVS recognizes that. They've got a whole system in place to try to mitigate those risks.
It's about making employees feel valued and supported.
Yeah.
Okay, let's shift gears a bit. I'm curious about their approach to ESG, environmental, social, and governance. There's a lot of pressure these days to be sustainable and socially responsible.
For sure. CVS acknowledges this in the report and highlights their focus on ESG goals.
But it's light on specifics, isn't it? What are they actually doing?
True. They don't give a ton of detail about metrics or targets, but they do mention a few areas of focus.
Like?
On the environmental side, they're trying to reduce their footprint, lower energy consumption, decrease waste, even explore renewable energy sources.
So addressing climate change and sustainability. What about the social side?
They mention diversity, equity, and inclusion in their workforce, also improving access to affordable health care, and addressing health disparities.
It's good that they're taking those things seriously. What about governance?
They talk about ethical business practices, data privacy, and strong governance structures.
Sounds like they're trying to be responsible and transparent.
Right. And with that, we've reached the end of our deep dive into the CVS Health 2023 annual report. We've covered a lot, from their vision of a world of health to their financials, their acquisitions, the regulations, and their efforts to build a sustainable business.
It's been a journey. We've dissected this report, extracted some insights, and hopefully given you a clearer picture of CVS Health. But as with any deep dive, it sparks new questions.
Absolutely. That's the whole point of exploration. It's not just about finding answers. It's about asking the right questions. So as CVS expands their role in healthcare, what does the future hold? Will their vision succeed? What impact will they have? These are questions worth thinking about.
Thanks for joining us on this deep dive. We hope you found it informative. Until next time, keep exploring, keep learning, and keep diving deep.